The 41st Union World Conference on Lung Health got underway at the Berlin ICC on Thursday, 11 November. A day-long symposium focused on tuberculosis and the Stop TB strategy.
This 41st World Conference on Lung Health, as you know, has the theme Tuberculosis, HIV and Lung Health, from Research and Innovation to Solutions.
What we want to do in this symposium is to look at the variety of different experiences, the variety of different elements of the Stop TB strategy.
More than 2,000 people from 120 countries will attend the 5-day conference. Press conferences were held to launch an atlas of acute respiratory infections and the WHO 2010 Global TB report.
The World Lung Foundation is coming up with an atlas on ARIs, which shows a public health problem which has been long neglected. We all know that a lot of kids, for instance, are dying from pneumonia needlessly, and we know it, but very little is being done. So Peter Baldini, Niels Fluger and the team has really to be commended to really try to get an excellent atlas on the way that will be able to raise awareness about this neglected areas. We talk about cardiovascular disease, we talk about cancer, but unfortunately lung disease is still something that is not sexy enough and is not dealt with properly.
20% of all child deaths in the world are due to acute respiratory infections. It's also a very deadly disease for the elderly. 1.6 million adults over the age of 60 die from acute respiratory infections. And most importantly, as you can see on the graph, this is the leading cause of death in the world for children under the age of 5.
Overall, since 1995, 41 million people have been cured from tuberculosis. However, and this is the however of the report, we still are looking at 1.7 million people dying from tuberculosis every year. There is no infectious disease that kills more than tuberculosis. Even when you look at AIDS, and you consider that the 2 million deaths due to AIDS, in a quarter we have tuberculosis as the real cause, and you calculate back, you will find that actually TB kills more than AIDS. No government, frankly, is doing too much on tuberculosis, otherwise we wouldn't be still seeing 1 million and 1.7 million people dying of it.
I'm convinced that it is most important to inform people and governments about what is needed, because there are not many governments, I would presume, that know that tuberculosis is such a big problem. I would like to stress it is firstly important to inform about this problem.